3 years now, I suppose. Oh, more than 3 years.
It's more than 3 years.
Just a
More
little
than
before
3 years.
COVID. Yes. You look good.
I do.
Yes. The skin is really glowing. Maybe I should take more fruits. I'm trying to do more fruits, but I think I need to do extra more.
And more water too.
Yes. I think I'm faithful on the water part. I need the fruits as well.
Okay.
Yeah.
All right. It's good to have you to be watching the replay for those who are live now. And those who don't know me actually, Esther John Eguche. I'm a registered nurse, a registered ophthalmic nurse with about 12 years of experience. I'm an author of over 21 books, a wellness coach. What else do I do? I'm an entrepreneur. I have a natural drink brand, natural drinks brand. So I've helped over, as of today now, we can say I've helped about 2,000 people improve their well-being using their consultation, coaching, webinars, natural drinks, and well-being books. So you're welcome to this section. You're welcome. And my guest today, today we are talking about cataracts, cataract surgery, understanding what it is. There are lots of controversy, being that cataract is actually the leading cause of blindness worldwide. But with cataracts, there is hope. So we are trying to, in this live section, we are going to be debunking myths. We are going to be sharing what cataract is and what is not. And my guests, let me drag you again. Because you are my madam.
Not at all.
Not that I've been trying to get you on this live session. You see, my eyes are red. I'm still trying to recover from the up and down of having a successful webinar. So I have Nurse Rita. Your husband is Yoruba.
A mixed breed.
Oh,
Partly Edo. So, but the surname sounds Yoruba. Most people think it's Yoruba.
okay, because I was trying to pronounce it. Nurse Rita Ogedengbe. I hope I said it well.
Perfectly. You want to say it in any better way.
Okay. So I have Nurse Rita here. How long have you worked for Eye Foundation now? How many years?
That would be roughly 4 years.
Just 4?
Yes.
That means you came in when I was leaving.
I came in September 2018. Yes.
Oh.
And then.
Okay. Because I did 4 years in Eye Foundation. Okay. So she works in one of the best. Eye Foundation is still one of the best eye hospitals in West Africa, the multiple award-winning eye hospital. And then she's a voracious reader. At least we share that in common. We love to read books, and she has experience. She's a registered nurse with many years of experience now in ophthalmology, ophthalmic nursing, and then of course you have a background in oncology, as you told me.
Yes.
And of course you have experience in counseling, because counseling is a big deal, especially when it has to do with eye. If the patient is not properly counseled, it can be a very, very big problem. So we are going to dive right into it. So what is cataracts? What is cataracts?
Okay, I want to thank you first and foremost for the opportunity to be, working with you. It's been a pleasure, like having to work with you one-on-one, though not in the same facility, having to see that, oh, this someone who is also a reader and author of books, I must confess that was really wild. It's one thing to be a reader, to enjoy what people do or what people write, their experiences, but I can almost guarantee anyone that it's difficult being an author, even if it's like a page. It's difficult having to put all your thoughts in paper and then having other people understand what your thought process is like. And when I read your book, I was like, I'm not sure this girl is in Nigeria. I was like, I was wild. It broke the protocol that doses don't read and doses don't write, because we've had that stigma for quite a while. You see us not doing so well in research because we really have a lot to give back to the society, but maybe we've not just taken the time and the discipline it takes to pen down our thoughts. So that has been something that held nothing back from the great potential that they have, in helping humanity. So thank you for that. I'm still grateful, and we're still learning. We're still coming behind you. We're trying to make a difference in our little corners and little niches. So we'll just go back to the topic at hand, and that'll be cataract. So simply put, cataract is a condition of the eye. A lot of people will say, oh, it's a disease, it's an illness, or all manner of thoughts. Or I like to define cataract as a condition. First, it's not a disease, and is most time often not an illness. So it's a condition that affects the eyes. In this condition, the eye's ability to see clear objects diminishes. So the object becomes sort of blurry. And then some people describing it as hazy vision. If someone was seeing clearly and the person develops the condition called cataract, the vision becomes hazy, less clear, blurry, and a bit discomforting. And this is something that is very fortunate, something that you can reverse, something that you can do something about. There are other eye conditions, there are other eye diseases and illnesses you really can't do much about, but cataract is the friendlier foe. It can be tackled. And I think we're here to discuss that.
Yes. So when it has to do with eye conditions and eye conditions, everybody wants to know what cause. There are so many, how will I put it now? So many lies about eye condition, and because they are lies, people and misconception, people tend to make mistake when it has to do with the treatment, especially since they are not really aware of the cause. So somebody is here and wondering what causes cataracts. What causes cataracts? So please, your thoughts on that.
Okay, thank you so much. There are various causes of cataract, various causes, but we're going to take the very common ones. Number one cause of cataract is still age. It's an age-related condition. As humans, we grow, we develop, we get to our optimal functional level, and then there's like a pause, and then there's a decline. It's a natural human cycle. So usually cataract is age related because it is seen or diagnosed in people of certain age range. So when individuals, male, female, get to the age of middle adulthood, like some people will say, from 40 to 60 years, those individuals are likely to have the condition cataract, and that's not far-fetched. This is also the time people begin to see wrinkles on their faces or white hair on their heads. So they are linked together because these are aging patterns. We may delay it as we may, but it's just a delay. It will eventually catch up with an individual, but the severity do differ. So age is one of the mostly pointed out cause of cataract. However, that's not to say that an individual less than 40, an individual less than 35 years cannot develop cataract. Funny enough, we then have other causes of cataract in which an infant can be involved in, so leading us to having a cataract infant. So you have conditions where a pregnant mother has some disease condition or is on certain drug, like high level steroid drugs, and then give birth to the baby, and the baby has cataract. So we also now have cataract affecting children. So the technical name for that is just congenital cataract. They are born with it. Something has happened while the baby was in the womb. And the first one I mentioned earlier that is age related is called the senile cataract, and that's the most popular cataract. That's what comes to mind when cataract is discussed. Another cause of cataract is also due to injury or traumatic impact. So I know that I grew up with this around me. So I used to have a favorite uncle of mine who, when he was younger, about 5, 7 years old, his stepbrother threw a stone, at him into his eye, and then a neighbor, a good Samaritan, supposedly, ground fresh pepper and then added into the eye that already had stone injury. And then, of course, he lost that eye because he developed cataract. The lens were immediately cloudy like 3 days after the incident. He had glaucoma later, and then he lived for it for years. I grew up meeting him, asking questions repeatedly. He was giving me the same answer. And so finally, when I had to work like in an ophthalmic setting, I could relate to the pain, to the frustration of these people because, it's something that I had lived with. It's something that was very close to home. So yes, cataract can be caused due to trauma, trauma like, you're engaging in a fight and then someone throws a blow into the eyes, trauma due to motor vehicular accidents, there's the impact and collision, trauma due to, aggressive shaking of the head. This is in Africa it's very common, in Nigeria it's also very common in certain religious, places of worship to display very extravagant way of worship, expression of their worship. And when you involve your head and you shake it vigorously, research has shown that there could be damages to the lens, or the lens will dislocate and then cataract can develop and all of that. Also, cataract can be caused as a result of other underlying eye issues, such as glaucoma. An individual who has had glaucoma, popularly called selective of the eye, may develop cataract during the disease process of the glaucoma or while treating the glaucoma in terms of surgical treatment, or using some prescribed medication or unprescribed medication, so to say, because a lot of people, due to lack of awareness, due to lack of knowledge, if they find something not right in their body, they'll always end up going to the wrong source for help, for information, so they can fall into the hands of people who just want to make a source of livelihood. They just want to sell their merchandise at the moment, so they can go to quote and unquote, a chemist shop, to say, oh, I noticed this in my eye, and the chemist shop just says, what, take this one, take prednisolone, add. So why using unprescribed drugs, so to say, by people who are not really licensed to give this information, they can end up developing cataract. So these and many other causes are what can lead to cataract.
Thank you so much. You were very detailed with the causes, because I would have asked, if you had not mentioned children, can a baby have cataract? So my next question you've already answered, because it's quite common from the age of 40 to 60, and like you emphasized, it doesn't mean that somebody who is younger cannot be a victim of cataract with long use of things like corticosteroids. It can predispose an individual to cataract, underlying disease condition too.
Yeah.
Cases of hypertension, diabetes, it can hasten the process of cataract. So what are the signs and symptoms? How do an individual know that he or she has cataract?
Okay, so cataract is a friendly eye condition. Why? Because unlike glaucoma, it will give you a sign that it's at the door. Okay, so the number one sign is the blurry vision. So individuals who otherwise have been seeing clearly will begin to experience blurry or foggy vision. So the visions are no longer sharp focus, they are blurry. It's as if one is looking through a film, or like some African people we notice as if you're looking through Hamatan fog. So, during the Hamatan, the distance you can see objects is quite limited due to the dust in the atmosphere. So the most people with cataract will describe their vision as, oh, it's blurry, it's not as clear, it's diminished. So these are um, signs and the symptoms. And some people, when the cataract has matured to a large extent, when you look into their eyes, you can actually see the cloudiness or the whitish part. The lens that is otherwise transparent, that shouldn't be so visible, becomes very obvious. And that is what we see in the case of like very matured cataract, people walking on the road. You don't need a medical practitioner to diagnose that. You already see the lenses that cloudy. So that's another one of the signs. And then when you go, to a doctor's appointment, people who otherwise their visual acuity test, they can read from the charts from top to bottom. They find that they no longer read from top to bottom. They cannot read from top to middle, and some will just read just the top, and some may not be able to read at all. And if they were able to count fingers, they are not able to decide if the fingers are there or count it accurately, but they can detect that it's wrong. Very worst cataract, very end stage cataract, they may not even see the finger movement, so you can lead to blindness or reversibility.
Yes, that's the beautiful thing about cataracts. It can lead to blindness, but is reversible. It's reversible. So how is somebody's watching this live and is wondering that, oh, okay, so if I go to the hospital, how would cataract be diagnosed? Are they going to do something to me that is going to be painful? I don't want pain. And the reason I have been delaying going to the hospital is because I'm afraid. I don't want them poking my eyes. I don't want injections in my eyes in the process of finding out if I have cataract or not. So how is cataract diagnosed in the hospital?
Okay, first and foremost, the process of diagnosing cataract is quite painless, quite painless. And it's very good that people know that it is painless so that they can take the steps in getting themselves checked and then diagnosed if need be. When an individual is preparing to go to the hospital or an eye clinic for a screening to find out if they have cataract or any other eye condition, the individual should know that first, it will take a little bit of the individual's time, about 1 to 2 hours. And the reason is because there will be a test called a dilation test. This is the test in which the individual will have an eye drop put into the eye. Some facility have it done differently. Some facility will give you a thorough check. And by thorough, they need to know what your vision is. So they will first of all do your refraction to get what your refractive power is. So the refraction itself takes a little bit of time, depending on how learned or how cooperative the individual is. Because if the individual is not learned, you may have to use like other versions of the chart that is for, meant for the purpose for those who are not learned, maybe using symbols, using signs that are easily distinguishable, having an interpreter go to the person to explain what the charts are. And then how the person is also able to cooperate. Some persons, they have like hospital anxiety. So whenever they're in the hospital, they'll first panic, they will get all the rules wrong and all of that. And I think that one of the major causes of panic is because they don't know what to expect. So visual acuity is one of the things that a facility that is thorough and grounded will like to have done to you, after which the dilated examination will come in. It's called the dilated examination because an eye drop is put into the eyes to open up the eye, so to say, so that the ophthalmologist, who is a licensed doctor that specializes in the eyes, and take a proper look at the eye, because the eye looks very simple, but it's actually a very wild and versatile organ. And the eye is so unique because with the eye you can almost, diagnose other conditions. You can know, oh, is this person diabetic? Is this diabetic controlled or not? Is this person hypertensive? Is stroke impending? Is there like a tumor in the brain? The eye is so linked to every part of the body that we neglect. Is the person cholesterol so high? What's happening with the liver? Is there need to carry other tests? So the eye may look small, but it's actually like a window into almost every part of the body. So that dilated examination is very important, because somebody may argue that, my cataract is prominent, even the devil knows I have it, or the beggar on the street knows I have it, but they still need for dilated examination, because there are different types of cataracts, there are different position and location, and whoever is diagnosing with intent to treat, we need to know the specific cataract condition they are dealing with. So the dilation, usually, depending on the kind of eye drop they use, will last about 35 to 45 minutes. However, some people, due to their health condition or underlying eye condition, may take longer time to dilate. So you see diabetic patient taking almost an hour to dilate because the pupillary response is very slow, so they have to have more drops. So when you're going to an ophthalmologist for an eye screening, that would be a very good time to block about 2 hours out of your time, not be in a hurry. What works for A may not work for B. So because your friend was dilated in 15 minutes, doesn't mean that you will be dilated in 15 minutes and the drop differ. But it's a what exercise, something that is worth waiting for. And I definitely encourage everyone to do that at least once in a year, if you can afford it.
Yes, very important. And when I hope I still remember my train of thought. When it's important to check the back of the, somebody is wondering that, oh, okay, it's very obvious that I have cataracts. Have they brought the lights?
Not really, but we have like a backup to help.
Okay. So when it's important to check the back of the eye, because if some factors, if the state of the back of the eye is not properly determined, even if you have cataract surgery, that's why it's very important. I tell people it's very important to investigate the kind of hospital or the kind of consultant or the kind of surgeon that is going to handle your eye, so that your expectation, what we call prognosis, is very sure. Because if a thorough examination is not done, and somebody counsels you on the basis of what they see, and they did not check the back of the eye to be sure of the state of your eye, because for an individual who already has glaucoma, the expectation after cataract surgery is not the same with somebody who do not have glaucoma. Even for somebody who the cause of the cataract is traumatic, because some part of the eye could have been affected in the course of the accident or in the course of the fight. So the expectations are different. So it's important that a thorough eye examination is done. I'm just trying to reiterate and emphasize on the points you made. So what are the treatment options for cataract? Somebody's like, I'm scared of surgery. Is it only surgery? What are the treatment options for cataract?
Okay. First and foremost, the treatment for cataract, as far as science is concerned now, and ongoing research, is surgery. However, there are a lot of, miracle, wonder working drugs, herbs, and all of that. Why this? Yes. So, why researching on this topic, I've come across people saying, oh, this drug cures cataract, this other procedure cures cataract. Like in the northern part of Nigeria, I learned that some people do what we call cornea scraping. And that's more like a backyard surgical intervention for cataract. That's
cornea scraping.
Yes, cornea scraping. So the northern part of Nigeria engage in that. So basically what they do is more like put a little bit of topical anesthesia into the individual eyes and go ahead to scrape the cornea. For the brief little period, the individual may experience less blurriness, but that's short-lived, and then damage is already done to the cornea. So the person still ends up with cataract because the cataract is really not touched, and then the person has an aberrant cornea. And this is due to ignorance. This is due to the fact that a lot of people are not aware that, this has come to stay. It's like having a gray hair. You can dye your gray hair all you want. It doesn't remove the fact that the gray hair is there. So some people go ahead and embrace the gray hair. Some people, decide to shave it off, and be done with it. But gray hair will still come up. But with cataract, it's a friendlier foe because with surgery, it can be corrected once and for all time. It's surgery that can be done once and for all. Especially if it's simply only cataract. It has no, other underlying eye condition associated with, especially glaucoma, and the rest like it. So surgery is still the only mode of treatment for cataract. And because of the advancement in technology, these surgeries are no longer like, heavy duty surgery. They are nothing to be scared of. They are even walk-in surgery. You can walk in, have the surgery done, and go home the same day. You can come in for your follow-up afterwards. You don't have to sleep overnight if you live very close to the facility where you're having it done. It's simple, and because also of the advancement in technology, your recovery time is so shortened. You have assisted technology, you have your lasers, you have your, machines that make the surgery fast, quick, efficient, and with less complication. So depending on what you can afford and where you live, your access to, very good facility, or even doctors who can use these technologies, you may very well have a neat surgery and then have less complication. So surgery is still the only way. And an average cataract surgery per eye is less than 20 minutes. And with the very advanced technology, it's actually less than 15 minutes. If you remove the prep time, from the time the surgeon starts to the end, it's less than 15 minutes. So recovery will take you about, 6 weeks or even less, depending on the technology and depending on your previous eye health before your eye surgery.
Right. Excellent. So what somebody is here watching diagnosed with cataract already. He or she's probably trying to gather money, trying to gather enough morale to eventually say, doctor, I am ready. When are we going to have the surgery? So what are we call it pre-surgery? What are things this individual has to be aware of, things that are very important the person has to have in mind before going for a cataract surgery to have the best results after?
Okay, so for your pre-surgery care, like I would like to call it, your pre-surgery precaution first, you need to make sure that you have been diagnosed by a licensed practitioner, and that you also have the dilated eye examination. So if the doctor who saw you, or the healthcare practitioner, has not, done a dilated examination, you must insist on it to avoid stories about touch. Make sure they have a comprehensive examination. And then secondly, the healthcare practitioner may want you to carry out a series of tests. These are non-invasive tests. Some are invasive, but most are non-invasive tests. One of the tests that is very important for cataract surgery is what we call the biometric test. So that is simply checking the power of your own natural lens. Because during cataract surgery, what the aim is to take out your natural lens and then replace it with an artificial lens. So ever before your natural lens is taken out, there is a need for your surgeon or your healthcare practitioner, your ophthalmologist, to know what power your natural lens is. And most practitioners differ on their various school of thought. Some will want to have the two powers, done so that they can check and do their adult and subtraction to give you the best power of the artificial equivalent of the lens that will be taken out. So some would like to do that before the surgery day, just to be better prepared that so that the power of the lens they want to use, they have it in their facility, because an hospital is a business. They don't have unlimited resources. They have very limited resources. So they just want to have that done before your surgery day, so that if perhaps they don't have that particular power of lens that they will give to you, they can source for it and get it ready. And this is very important with facilities that have good reputation, because they just don't want to do any kind of job. They want to do an excellent job, because when you have a good result, you are able to bring more clients to them. So it's a win-win for both the client and the facility. Also, some facilities go ahead, to do other tests just to be sure that you are safe. They can do a blood work test for you. They're just simply checking for your sugar. If you are diabetic, they need to know if your sugar under control. They need to know if they need to insist for you to, be more compliant with your diabetic medication or what have you, so that the work they will do in your eye will not be damaged by another health condition. They need to know what your blood pressure is it fluctuating? They need to know what your HIV status is, and that's simply for their benefits and the next client benefits. So they need to be better protected. If you're HIV positive, that wouldn't keep anyone from having to carry out your surgery. But take better precaution. They will sterilize the instruments carefully so that they don't pass it on to the next person. Some facilities will insist on this blood work, some do not, simply because they may not have the time, they may not have the resource, or even the laboratory, what have you, to carry out this test. But one thing is very paramount: insist that your healthcare provider has a biometric test carried out for you, especially if they plan to carry out your cataract surgery. So these are the before knowledge. Also, you must also know what to expect in terms of your drug prescription. Some will have you buy your medication before surgery. Some will want you, to deposit a certain amount of money. They want to be the one giving you the medication, so that they trust that the drug is, the right brand, the right potency, and all of that. While some are not very particular about it. If you like, you can get it outside. If you like, you can get it from them. They're really not particular about it. And some will also like to be sure that you've taken some time off work, because after cataract surgery, you will need some time off. Some facility will go ahead and bandaging your eye to be sure that very day you have a cataract surgery, you're not using that eye. The bandages. The facility where I work, that is a usual practice. It doesn't mean that other facility will not leave your eye open. At most facilities now are embracing the no bandage option, but still they want to make sure that you take some time off work, because the eye needs to recover, it needs to rest. They also let you know what to expect. If the eye is not bandaged, the eye is going to be swollen, it's going to be watering at a point. You need to instill your medication probably every hour or every 2 hours. They will demonstrate to you how to put the eye drop ever before your surgery. Some will wait until after your surgery. But it's best practice to let patients, practice this before the surgery, so that they are well, prepared for after surgery. And some will also, give you health talks on things to avoid, like you can't go swimming immediately after your surgery. They'll let you know when you can go swimming. You can't carry like heavy loads on your head. You can't do like rigorous exercise. You can't flip your head back and forth. You can't bend. You won't let water enter the eye. There are instructions on how you sleep. You sleep on the non-operated side or on your back. You can't chew something hard like bone or something crunchy. They let you know things about your diet. Some will go as far as checking your previous medication that you are taking, especially if you're on blood thinners like vasopressin and clopidogrel and the likes. They will want you to hold on with this medication for some days. If that doesn't tamper with your health or that ailment you are having, so that it will limit bleeding in your eye. Also, if you are on medication for prostate, and this applies specifically for men, some men are on some medication. You also need to let your ophthalmologist know so that they don't give you other medication that can reduce the potency of that medication. So they're going to give you like an extensive do not, and it's a very good time to ask questions. If you're someone who can't do without carrying something on your head, it's a good time to ask. So what happens if I carry something on my head? What happens if I must swim? What happens if I have to, chew meat because it's your enemy's area and you have to say that, yes, you are trying to over your enemy, you must chew that bone. It's a very good time to ask for clarity. But there are over, 15 do not. It doesn't apply to everyone. It doesn't apply to some people. For ladies, you want to know, can you do certain hairstyle? You'll be lying down while the surgery is being done. So with the hairstyle being a hindrance for you, you have to come in without makeup because obviously this surgery and makeup could serve as a source of, infection into your eye, the mascara, the eyeshadow, what have you. It's not that we don't want you looking nice. You need the eye to be, free from microbes or infections and infection causing organisms. So we have to withhold on that. So usually a healthcare facility will tell you what their process is like. And believe me, it's very good to pay good attention. If possible, you can get like a printed or a written material, just to refresh yourself. And they are more than willing to hand it over to you. You can always ask questions. Ask questions, especially questions that are peculiar to you as an individual or your loved ones.
Very, very important. Very important. So, because when it has to do with, I think they say there are some people you shouldn't lie to. I think it's your pastor and your doctors. Ask your questions. Obey instructions. There have been cases of women we've had to lose their hair or cut their hair. They went through extreme process trying to fit them to have that surgery. So just come as simple, because your face, you have to be comfortable while having like she said already, the surgery will be ongoing for some minutes. So you want to be comfortable, even if you are awake. Even if you are, most times now is you are awake while the surgery is ongoing. So you want to lie still, you want to be comfortable. So your hair, the hair you're carrying matters. Your face, because if you come with makeup, they will have you wash your face, and you may not like the kind of soap they provide in the hospital for you to wash your face. So to avoid things like that, just come, obey the instructions like she has said so many. I'm trying to remember some other ones. And then for the men, you have to be clean shaven, because after the surgery, we don't want you to go and cut your hair. We don't want hair particles to get into your eyes or your ears. So just try and have a bit of haircuts of your hairs, take care of them, so that you still look presentable following the time when you are asked to resume your grooming. And then so post-operatively, if there are no underlying conditions, what are expectations? What should the patient expect after cataract surgery? Before you answer that question, if you are live and you have any question, please, this is the best time to drop it so that it can be answered. Okay? And for those who are just joining, we have Nurse Rita on this live call, and we are gisting actually about cataracts, understanding cataract surgery, the do's and don'ts. So please, post-operatively, what do we expect if there are no underlying conditions? Emphasis on underlying conditions. If there are no underlying conditions, what should we expect after a cataract surgery?
Yes. So postoperatively, if there are no other underlying conditions, usually a cataract surgery prognosis or outcome is usually about 98 to 100%. So it means that if you were reading from top to bottom before you developed cataracts, and then maybe you are reading halfway after the cataract, once you've had your cataract surgery done, after the period of healing, there's a healing period. So it's not going to happen like immediately or the next day for our post-surgery. But after the healing period, which is usually a span about 4 weeks to 12 weeks, which is a month, to 3 months post cataract surgery, the person can expect to have their vision back, restored to normal, from about 98 to 100%. Some people actually will go ahead to say that they now see much better than before they ever develop cataract. Research is yet, to look into those claims, but without underlying condition, cataract surgery restores your vision back for people who have cataract, except of course by condition.
Thank you
However,
very much. Okay.
yes, I just
Go
want
ahead.
to mention that some individuals, within the first 3 months of their surgery, they have perfect vision, so to say. And then after a while, they find out that their vision declined again. That's very, very common. It happens with Africans or African American descent because their body in while healing develops what we call post-capsular shield at the back of their lens. So is a body defense mechanism. It's like what happens when individuals shave and they have keloid on their neck or scars. So the body can have that done. But that is not to discourage anyone from having a cataract surgery. It's very common and it is very easy to treat. So most people, if you have had your cataract surgery and you experience that, or your loved ones have experienced that after a period of sharp vision, their vision kind of decline and there's blurriness again, that can be handled this time not by surgery but a laser procedure. You can just have a YAG laser to, put holes into those capsules that form like a shield or an umbrella behind the lens, and that restores the vision for life. So you don't need to go through that again. Once people who develop that shield have the YAG laser, they don't get to do that again. So it's very possible to have a bit of decline after the surgery.
Okay. All right. Thank you so much. I want to find out when is the right time to have cataract surgery. So people say, oh, the cataract is not ripe or it's not matured. When is the perfect time? Have you experienced cases of people who did not wait until it's matured, very obvious to everybody? Was it a success? Have you had people who waited until it was matured? Was it a success? So what, in your opinion, what is the best time? Or based on your experience, actually, your clinical experience with cataract patients?
Okay, so based on my experience, because usually, I grew up hearing, oh, that's not yet ripe, so therefore you can take it out and all of that. But by experience, I have personally observed that the best time to take care of a cataract is when the cataract is freshly diagnosed. As soon as the cataract is diagnosed, that's the best time to take it out. So it will be at the very early stages, but believe me, that's the best time to take it out because first, early cataracts are easier to handle, especially by professionals who have the right tools. So in the past, due to lack of access to technology, due to access to lack of skill, the ophthalmologists, they may not have the right skills to use available technology. Some of them will wait until it's right because they want to make a larger incision. They want to make it easier for themselves. They make a larger incision, extract the cataract, pop in the new lens, and close up. But practice has shown that manual extraction is really not the best type because it comes alongside with complication. There is delayed healing that leaves you susceptible to infection. And when you think about these things, you find out that doesn't really add up. That's not a wise one. However, some people, their cataracts will just have to be discovered late because they don't have the resources for a proper diagnosis. So they're just going to come in at the later end when it's already very matured. So you can't say, oh, because it's not matured, I'm not going to have it taken out, or insist that there's no remedy for you. So as soon as you're diagnosed, that is a very good time to have it taken out. You may need like some weeks to get financially ready, but do take it out as soon as possible because if you leave cataract for too long, you are, leaving yourself open to other conditions. There's, you're at risk for having glaucoma because the lens can swell up, block out the channels for drainage, and then your eye pressure can go up. And also, some people, they've left the cataract for so long that, the Morrogan cataract, when the cataract is even taken out, the eyes find it difficult, you know, getting back their vision of light. So that's very possible. Then, I know that may contradict people that say that, oh, cataract is easily reversible. It's easily reversible, but there are some cases where the eye is so used to being blind that even when the cataract is taken out, they will really need rehabilitation, so to say, to see again. So the best time is to take it out as early as possible. I also want to mention that some professionals like pilots, people who depend on their sites for their source of livelihood, entertainers, content creators, bloggers, they really need to have their eyes open at all times. They don't want to have to wear glasses. But some people, they may not want to do cataract surgery right away. They can actually use glasses to manage, and these glasses they have to change like every 2 years until it becomes like too frequent that they can't keep up. Then they just have to have surgery. Some people don't want to have to wear glasses. Their jobs will not permit them to wear glasses. Maybe they work in water or whatever, so they need to have it taken out. In fact, they can't wait. They are saying, "Oh, is it there? Can you see anything? Is it time to go under the knife?" Just to have it done with, and interfere with their lifestyle or their source of income. So most people are being proactive about it. They are coming in, they're having the cataract done as early as 40, 41, maybe.
Okay. So can cataract spread from one eye to the other? Just because I have cataract on my left doesn't mean I'll have it on my right.
Usually, cataract is usually bilateral in nature. So what that means is that if one has cataract in A, there is a very high chance of having cataract in the other ID. So, however, some cataracts, such as trauma-induced cataract, could just be unilateral, just affecting one eye. It could be it's trauma. The trauma affected maybe one side of the face, so automatically it's that affected eye on that part of the face that has the trauma or the cause of impact and may develop cataract. Otherwise, if it's denied cataract due to age, congenital cataract, most times is bilateral. Some congenital cataract are actually unilateral. So it depends on the cause. It could be bilateral or unilateral. However, cataract does not spread, from one eye to the other. It's not like conjunctivitis or any of those things that, oh, you have it here, don't rub here, don't use the same hand, you're going to affect your neighbor, your husband, or your children. No, it's not contagious. It doesn't spread, so to say. However, the degree of the opacity or the blurriness of the lens may differ. You can find out that even if you have cataract in both eyes, you're still seeing better in your right compared to your left, because your left is more, cloudy than the right, but it doesn't spread, so to say. It doesn't.
All right, thank you very much. I don't want to keep you for long. You're going to work tomorrow, right?
No.
Okay. Oh, okay. You are free tomorrow.
Yes.
So I think we've dealt with everything that concerns cataract and cataract surgery. So I want to really thank you for your time. I don't want to do this for that
so
one
much.
I couldn't get questions on this live, but I've tried to ask questions. I feel that I frequently ask questions surrounding cataract. So I really, really, really want to thank you, because sometimes I get tired of talking about these things. It's good to have somebody different, especially since you are in clinical, come and share experience, come and talk about these things so people can hear, and the myths, the lies about cataracts can go away, because so many people have gotten into trouble just by misconceptions, just by taking advice from their neighbor who so many stories. In fact, if you are in the hospital settings, you meet stories of people that they had no business suffering from what they are suffering from the eye condition, but because they took advice from people who are not professionals, they added things to their eyes that are not recommended. That doesn't make sense. Like the story you shared, please, how does it help trauma? How do somebody's having pain in the eye, how do something hot actually help? It's very ridiculous. But things like this happen every time. So I just want to thank you for your time. Thank you for
so much.
this 1 hour. So next time when I apply, please kindly indulge me when you're free, because I enjoyed it.
Definitely. Thank you so much.
Down and not one exacting and explaining and everything. So thank you so much. I really appreciate it. And please help me thank your husband. I saw his face a little bit while I was trying to help you out.
Yeah.
So I extend my gratitude to him. Good husbands are very helpful. They make our life easy.
They make the life easier.
Mentors and make our life easier. So thank you so very much. Have a wonderful night.
You too. Thank you so much. Grateful.
Okay.
All right. Good night.
Good night. Okay, so we've come to the end of understanding cataracts and cataract surgery. I hope you learned a lot. I hope you took notes. I hope whatever misconceptions or fears that you have has been allayed. So you now have facts you can work with and make your decision. So if you've been asked to go for a cataract surgery, you've been empowered with pre-counseling information and even expectation post-cataract surgery, so you know what to do. Ensure you do. If you need to, you might need to get a second opinion. Okay, if you're not sure of the hospital managing or the doctor managing you, it's okay to get a second opinion. Is your eyes we're talking about, and decide. Okay, decide. I wish you all the best. It's still your favorite ophthalmic nurse, Esther John Ebuche is my name. Till we have another live session, take care of yourself. Good night.